We aim for the most comprehensive testing to be performed prior to surgery. In some cases, families will choose to do some of the tests at their home institution, and we can review those tests to determine if they are a candidate for a biventricular repair. In other cases, families will come to Boston Children's Hospital and have the testing done before their surgeries. There are a number of factors in terms of making that decision of where their testing is performed. In most cases, we do like to do the testing at Boston Children's Hospital because our team of doctors knows exactly what we're looking for, and that helps us plan for the surgery. In terms of what tests we actually perform, we do the standard tests that most people are familiar with, for example, an electrocardiogram and an echocardiogram, which gives us some two-dimensional pictures of the heart. The echocardiogram is particularly good at looking at fine detail in the heart, so for example, things like valves and valve function. And so we definitely rely on images from the echocardiogram to understand how to do the biventricular repair. But we also do a number of other imaging tests as well to help understand what the heart looks like, which will help guide the surgeon. Two of the more common tests that we will often do would be either a cardiac MRI exam or a cardiac CT exam. And these tests are essentially what we call cross-sectional imaging. So what they do is they take a picture of the entire chest, and it gives you a relationship of the heart to other structures within the chest, as well as the locations of the specific structures within the heart. And from those images from the cardiac MRI and cardiac CT exams, we're often able to develop a 3D model, which is particularly useful to surgeons when they're doing their operative planning. The other testing that we really like to do in many cases is a cardiac catheterization, and that test gives us a lot of information about the hemodynamics of the heart and the body. So for example, it gives us information about pressure within the heart, as well as the health of the lungs and the health of the circulation. We use a combination of testing and put them all together when we're deciding, number one, is somebody a candidate for biventricular repair? And number two, how are we going to actually perform that surgery?